So 1 in 4 adults suffer from arthritis. And if that's not enough, check out some of these other arthritis facts, okay? 60 million Americans have it. The average age of arthritis sufferers is 48. And women are 2 times more likely to suffer from it.
So that's why we're putting the spotlight on what you can do to manage it if you have it and prevent it if you don't. So joining us this morning is Dr. Karena, board-certified physical therapist and an arthritis sufferer herself. So good morning, Dr. Wu. Thanks for being here.
Good morning. Thanks for having me again.
Yes.
So like we just said, you suffer from arthritis. You have it in your knee.
My left knee.
Okay. How did that develop?
Full disclosure, I probably didn't stretch enough and I didn't keep my muscles strong enough. So it happened at the age of 48.
Okay.
And all of a sudden I could not put weight on my kneecap. Like I had to get up onto my knee to get into bed and I could not put weight onto it.
Now, you had surgery, though.
I ended up having surgery, which did help, but I'm not saying this just as a physical therapist, but physical therapy, rehab, the strengthening exercises, any manual therapy, that is crucial after any sort of surgery. And I'm still recovering. I'm still working really hard to get this muscle around the knee really strong.
Yeah, you know, and arthritis, when people hear the term, they often think of elderly or older, but more younger and younger people are getting arthritis. Nearly 300,000 children have arthritis. Why are you seeing the numbers kind of going in the reverse?
So for the children, and it's very sad because you can hear of 18-month-olds with juvenile rheumatoid arthritis.
Wow.
There is a genetic and hereditary component. But for the other ones, the kids that are like doing more, they have increased activity, they have lots of sports that they are playing in, so no breaks from the sports seasons, and then between the different seasons, those kids are getting overuse, repetitive stress, and that is going to lead to the overuse breakdown.
Wow, that's really surprising.
Yes.
But we've all heard that women get arthritis more often than men. And why is that?
The women, it might be because we're more loose than the men, so we do have more laxity, and that micro amount of motion that you can have if you don't have good stability, and stability is good control of motion. If you don't have good stability plus the strength and the flexibility around the joint, that can be another cause of getting arthritis sooner.
Oh, wow.
And so there are certain things you can do to help if you already have it or even prevent it, right? It all kind of goes back to diet.
Diet, yes. So things like fatty foods, refined carbs, processed foods, alcohol, sorry to say, and sweets. Anything that has an inflammatory type of response in the body, those can be exacerbating.
Right.
Yeah, but there is kind of a way to reverse it once you have it.
There are some joint supplements that you can take. You can have hyaluronic acid injections. Those can help lubricate the joint. But typically with osteoarthritis, which is a breakdown of the cartilage in the joint, that is usually not reversible. So stem cells, injections, and those types of things, those are trying to help promote that, but it will never grow back exactly the same.
Yeah.
It will help, but the exercises on top of that play a huge role in that.
Yeah, not to get too scientific, but you said osteoarthritis versus rheumatoid. What is the rheumatoid?
So rheumatoid is the systemic one. It's where there's an Rh factor in your blood, and then the osteo is bone. Osteo refers to bone. So it's the bone wear and tear arthritis.
Okay.
That's the older person arthritis.
Gotcha,
yes.
okay.
I mean, obviously working out, strengthening the muscles that you said, and getting more, more flexible are part of the solutions. But when do you know that surgery is really the only option for you?
So typically you have had to have had a course of 6 months of physical therapy. You're supposed to do conservative care to make sure that you have exhausted all methods. So conservative care is the outside of the body reduction of pain and inflammation, teaching the patient the stability exercises, controlling motion, then the strength, which is moving and pushing against force, then flexibility, which is stretching and then using a foam roller or the massage guns.
Oh, yeah.
Yes, to keep the muscles sort of pliable around the joint. So you're reducing compression in the joint. But if after that, plus also the minor invasive techniques, which are the injections and those types of things, or even medications, sometimes you need the surgery.
Okay, gotcha.
And that's when you go down that route.
Yeah, all right. And so this weekend, it's all about awareness and raising awareness. We're going to be seeing you at the New York City Walk to End Arthritis. So tell us about the event.
Yes, so it's the New York City Walk to Cure Arthritis. It is also the 75th anniversary for the Arthritis Foundation. So that's 75 years of progress in supporting the millions with arthritis and they've spent over $500 million in clinical research. We have big sponsors this weekend. We have HSS, NYU, Northwell Health, and Lenox Hill Orthopedics.
Great.
Yes. So our walk is Saturday, May 20th. It is down in Foley Square, which is at Lafayette and Worth. The registration starts at 9. Our walk program commences at 10:15, and it's a 2.2-mile walk down historic Broadway and back.
Nice.
You don't have to walk it if you cannot, but we would just love for everyone to come. And obviously, if you can't make it, a donation is great. And registration is at thewalktocurearthritis.org/NYC.
Rain or shine.
Rain or shine.
All right.
Rain or shine. We're there.
All
There
right.
you
Thanks,
go.
Dr. Wu. We appreciate your time this morning.
Thank you.
I'm going to be
good.
taking some of that advice for sure.
Absolutely.